Welcome to the Dallas Duo Podcast,
your weekly wellness coffee date.
We're friends in Dallas, always looking for the best ways to optimize our health
and have fun along the way.
Today, we're diving into a topic so many women don't talk about until they need it: recovery after surgery. Our guest is Eliza Stevens, former ER nurse turned entrepreneur and the co-founder of the Post-Op Collective, a Dallas-based team of licensed nurses who are redefining what safe, supported healing looks like, whether it's after a C-section, diastasis repair, or elective surgery.
The Post-Ops Collective team of expert nurses brings clinical support, concierge service, and peace of mind to one of life's most vulnerable moments. As busy women, we're expected to bounce back fast, but healing well, that requires a plan. And today we're unpacking how recovery is strength.
Welcome.
Hey, thank you for having me.
We're so excited to jump in. I am so interested to learn how you were inspired to start this. We are so lucky in Dallas to have so many entrepreneurial concepts, especially in the wellness and health field, that I'm interested to know where you got your idea.
Yeah, absolutely. My background is actually in emergency room nursing. And while I was working in the ER, sometimes I would pick up extra shifts to help out at a plastic surgery office here in Dallas, and I was doing their surgery recovery. I would help patients just in the exact post-op period recover, make sure they're doing okay, and then facilitate with their family getting home. And there was a little seed planted there because I took a mental note that when I would call patients' families to come pick them up, there was a little bit of a burden there. No matter how much they had planned for this surgery, they paid for this surgery, and then they would almost forget that, oh, how am I going to get home? What am I going to do when I get home? And I couldn't believe the amount of people that would just, either their spouse or friend said, can you give us a few more hours? I can't come pick them up right now. Or they would say, I have no idea what I'm doing. And they would need a quick and dirty, what do I do when I get home? And I just thought, wow, there is a real need for somebody to transition at the end of surgery to help patients when they get home. So continued my career in the ER and then ended up going back to grad school at SMU. Went through business school there and really kind of ran this company through. And with the support of my friends and family and eventually Heidi coming on as my business partner, now we're able to fill the gap in the market, which is post-op care. So it's come really full circle. And I'm really grateful to be able to help patients in a really tough time after surgery.
That's so awesome. I actually, side note, was a personal assistant and she had elective surgery and she hired me to stay with her. I just remember this now.
That's a responsibility.
But she was like, and I was getting paid. I was like very nervous in grad school. She's like, you're going to pick me up at 11 from the doctor's office. You're going to cook all my meals. You're going to flip me over the middle of the night because I can't move myself. And it was so much pressure. But just like you're saying, she didn't have family. She didn't have anybody to help. And so she essentially did what you're providing, right? She hired somebody to make sure that it happened because she knew she couldn't do it alone.
Yeah. Well, and it's amazing that you bring a medical background to it. I think that definitely would provide people with that extra peace of mind.
Yeah, it's different than somebody who literally didn't know what they were doing. I was just following and reading the papers in the bathroom, trying to figure out what I was supposed to do.
I think about back to both of the times that after I had my children, I wish I would have had someone home, because my husband had to go back to work pretty quick. And
you home with a packet of paperwork.
Yes.
It might be old. It might be folded over. It was shoved in your purse. And then you get home and you're tired. You might have had medication. And that's not really the time to be reading your discharge paperwork and trying to figure this out. So that's where our team comes in. And most of what we do a lot of times is providing reassurance to patients. It can be really scary and vulnerable after surgery when you were just under anesthesia and now you're out and going home. That's a 180 for the last 12 hours that you have, to look at their incisions and say, hey, everything's looking great for right now. It's exactly how it's supposed to, and check their vital signs and really offer them peace of mind that you're doing great. You can do this. And a lot of times in plastic surgery, it can look worse before it looks better. And that's what a lot of patients don't realize is, oh my goodness, what have I done right after surgery? They don't want their husband a lot of times to see them like that. So for us to be able to step in and be their advocate and help them through that kind of scary phase, it's really rewarding to see them on the other side when they're fully healed, and so glad that they had someone to help them.
I love that. That's so empowering. What and really who is behind the care at Post Op Collective? What kind of experience do you feel like you bring to the table? I know you said you have this awesome team with you. Do you have a group that now you're sending out, and are there specific characteristics you're looking for in those team members?
Yeah, absolutely. I, along with my business partner, Heidi, I have a background in emergency room nursing. I've got my bachelor's degree from TCU. Spent a little over 6 years in the ER. And of course, the business school after that. My business partner, Heidi, is a nurse anesthetist with over 12 years in the CRNA space. Before that, she was an ICU nurse. And so the two of us have kind of the medical knowledge of OR, ER. We see the worst and the best. They're all registered nurses. So, why that's important is because they all have critical thinking skills. So, they know how to look at
Mhm.
something and say, okay, that's not healing right. That doesn't look right. These vital signs are off. And all of the nurses that we hire have that background of either working in critical care in the ICU or the ER, or, of course, PACU and the OR. PACU is the post anesthesia care unit. So that's typically where patients go after surgery. So it's really important to us that all of our nurses have the skill and assessment level to be able to identify something that doesn't look right and be able to escalate that back to their surgeon promptly.
It sounds like that's what really sets your service apart from other recovery services. What are some other things that you think set you apart in terms of the services that you provide?
It definitely does. And we really pride ourselves on our nursing staff. They are top of the line, would be comfortable going in anyone's home and caring for their family. I would personally let them take care of me and my family. I think one thing that sets us apart is that we are concierge recovery. So we go to the patient. A lot of things that
Mhm.
are offered in the market are patients can go to a facility to get recovered. They can stay
Mm.
at their surgery center sometimes overnight. But at the post op collective, we go with the patient afterwards. Most of the time, patients overnight at either if it's a accredited surgery center or if they're having to stay in a hospital. A lot of times, that's just because their surgeon wants them monitored overnight for that first kind of 12 to 24-hour period. But a lot of them are allowing their patients to go home as long as they have a nurse with them overseeing their care. So we take care of patients in home if they're local here in the Dallas area, and then also at the Hotel Crescent Court in Dallas. So we give them the option to kind of choose which recovery. A lot of times our moms really like the hotel option because, even if it's just for one night to be able to take a deep breath, relax, kind of feel like you're getting your bearings again before you go home, and it's kids, it's husband, it's
Mhm.
life that you have. It's nice for them to be able to sit and reset and then be able to go home. So we offer overnight care, and we also do our tuck-ins, which are we just see the patient at home after surgery, and then we'll go see them either that evening or the next morning too.
That makes a huge difference. I think, like, even after I had my son, we had all of our care in home for 6 weeks, and people thought I was really crazy to do that, and, like, you couldn't have paid me to leave the house. Like, there was
Right.
no way that I was going
Well,
to
after
leave.
COVID, there's this sort of expectation now that people
Mm.
are wanting care to come to them. And that's something that I think the healthcare industry as a whole sort of recognized that shift quickly, which
Mhm.
is interesting because usually healthcare is very behind other
Mhm.
industries. And I actually think healthcare is very ahead of this now and starting to realize that patients want you to come to their house in the safety of their home and their healing environment, especially when we talk about healing in plastic surgery. If you have incision, it actually is better to heal in your own home environment and your biome and the bacteria that you have around you versus
Mm.
being somewhere else and potentially being exposed to that. So there is a certain expectation level now that clients have that they're going to have great care and that you're going to come to them.
Well, I think so many more questions naturally come up when you're in your own home space of,
Mhm.
like, how am I going to, like, mobilize through my house? How is this going to work for sleeping? But also, like you mentioned, like, infection rate, like being in the hospital alone, like, you're kind of just setting yourself up for greater risk by being in that facility versus in your home.
Yes, and as women, we know ourselves better than anybody else. And I think being able to have someone come into your home and really listen to what you're saying, if you're uncomfortable, and our nurses have the time to sit with you and really make sure if you have a recliner, that you're set up well, if you're going to stay in your
Mm.
bed, that you're comfortable because recovery doesn't just end after one day or even 2 days. A lot of times, patients are healing for the next few weeks, especially if they're
Mhm.
getting a mommy makeover, a facelift or a neck lift, the recovery time is a lot longer. So even if you spend the night at a facility, that's great to get you through the first overnight, but it's a long road ahead. So our nurses are able to come and assess your home environment and say, hey, this probably isn't safe to have when you're trying to get up and down, or have you considered this way to shower versus this? So being able to really do safety checks too at their home and guide them of how they can go up the stairs and walk around, things like that.
Well, and I also love that you offer the hotel option for people who are coming in from out of town, maybe to get, because it is popular to come to Dallas for specific surgeries because we have so many great doctors here. But also for people who may just need another place to rest if too much is going on at home and they're not able to rest and recover well at home for whatever reason. Do you find that you have a lot of people utilizing that service since you've started?
We do, yes. And they love it for exactly the reasons that you mentioned. And, this summer we've had lots of patients staying at the hotel, and we've heard from them saying, oh, I sent my kids to summer camp for a few weeks, and this is my kind of me time, my vacation time to reset while they're gone. So for them, to get through the initial period and then have another week to stay at the hotel, and then if they need to utilize any of the spa services or just feel pampered while they're there, then they really do feel like they're doing something for themselves, and that they're more confident when their kids come home and they're able to make it through the rest of the summer and get back to school. But yes, a lot of patients do like the hotel option. We have a private entrance that we utilize. Privacy is super, super important to our patients. Most of the time, patients don't want anybody knowing that they had a procedure done or that they've even had any surgery. So for us, being able to maintain discreet care so that they aren't walking through the middle of the lobby with bandages and everything all over their face and head, we're able to take them into a private entrance and then work really closely with the staff there to help with any needs that could come up while they're there.
That's incredible. For mothers listening, why do you feel like this is such a game changer for them in particular? I know that is like your ideal customer and who you see all the time.
So, with recovery care for moms, for them to be able to be home and still manage the household right there, whether they're in the guest bedroom or if they're in their own bedroom, they still feel like they have a pulse on the family. So they don't feel like they're far away or in an environment where they are unfamiliar and they're thinking, oh no, who's with my kids and what are they doing? Are they on time somewhere? Did they get to tennis practice on time? Who's going to help put them to bed? Moms really like that they can still feel a little sense of control while they're recovering and taking care of themselves by being so close to home in their own environment. And just to know that they also can, get away a little, but still let their kids kind of live their normal lives. So it doesn't uproot schedules. So to be able to get back to your home environment and get the house kind of back to a routine is good.
What are some of the most common procedures that you support through recovery?
The most common procedures that we take care of are the mommy makeover, facelift, neck lift, blepharoplasty. Those are our most common. So, especially summer is typically a little bit of a slower time for plastic surgery. That's because when it's hot outside, it's not ideal for a healing environment. It can increase swelling if you're by the pool. If you're like me and you love Mexican food and you're going and sitting on a patio, it's not ideal. Typically, summer is a little bit of a slower time, but it's been all mommy makeovers, you said neck, and then the blepharoplasties and rhinoplasties as well. So a mommy makeover really is just a combination of two things. So if patient's getting an abdominoplasty, maybe they're getting a little bit of lipo or a breast lift or a breast revision. That's usually what patients are doing, just doing a couple of different things at a time.
And what's kind of the typical recovery time for those procedures that are more, extensive like that?
Usually it's about a month, about 3 weeks for patients to feel like they can kind of start slowly if they work, getting back into their work routine. And then another month after that, usually to get back into their exercise routine. And, in the first couple of weeks, we're really trying to keep their heart rate below 100. So the first couple of weeks are, we really try and have them rest as much as they can, which again, for moms is so hard. And that's what I would say is one of the most difficult parts for moms recovering, especially keeping your heart rate under 100. When you have kids, your heart rate is probably over 100 all day.
Literally never.
Right. Yes. So for the first couple of weeks, just maintaining that rest and relaxation, because there's a certain level of confidence that comes the farther that you get out from your surgery where you think, oh, I got this. I'm feeling a little bit better. I can start doing more power walks around the neighborhood. Maybe I can get back to Pilates or bar. But we really try to tell people to take it easy in the first 2 to 3 weeks and slowly incorporate those lifestyles back in and not just go back into it, because it also will affect their healing and they will be not very happy with their long-term results if they rush healing too fast.
I know that there's a big myth that your husband, your spouse, your partner, your friend can just help out post op. Why have you found that that isn't enough? I know you've probably seen a lot of things, especially before you started Post Op Collective, that made you think, like, absolutely no, that is inadequate for care.
Yes, and I hear this all day, every day, talking to clients in their consultations. And one of the first questions that we ask them is, do you have help at home and what does that look like? And 9 times out of 10, our patients are saying, well, my husband's here. He's able to drop me off at surgery and take me home. And then, he'll be at the house. So it's not saying that their husbands or their spouse is incapable of doing it, but they are not a lot of the times medical people who know what's right from wrong. So an example would be, we had a patient that had drains after her surgery, and her drains were looking absolutely perfect. They were the color that they're supposed to be, the correct output. And I was coaching her on this. And then her husband was there in the middle of our tuck-ins. And I came back and she said, oh, my husband, he's came and looked and said, it's so red, or it's so this and that. And so then she was getting worried when in reality she was healing perfectly. And that's exactly what they were supposed to look like. So a lot of times it's just that edge of someone who sees a lot of post-op care and can provide that recovery. But, people think my husband can do this, but they also don't also consider that your husband, you're going to be relying on him for other things while you're recovering. So your husbands and spouses can't do it all. They can't be your nurse, and they can't take the kids to soccer practice or to school or sports. They have to do dinner time, bedtime. All of those things are a lot of what the husband and spouse are taking on while you're recovering from surgery. So to add another thing on of, oh, did you remember to take this medication? We need to walk you slowly and not in a rush up and down the hallway just a little bit. It really does add on a lot. And to have someone to come in and say, hey, you take hold of the household, get everybody organized, and we'll take care of your wife is really, really what we speak to husbands about a lot. And then being able to educate them and coach them while they're going. That way, once they graduate from post-op care and they're good to go, the husband feels more confident of what things are supposed to look like and not look like.
Well, and I think it's so unique that you have ER and OR experience, because it's honestly just like a different type of nurse, that you're not going to freak out if you've seen infection, or if somebody, does have an issue and it needs to be revised, that you're going to handle that calmly. And I think that that's one thing that's missing a lot of times in that helper that's at home, is that all of a sudden you're like freaking out because you think you might have an infection, and then your helper's freaking out too. And like that just doesn't really like help the body or the healing process to have a lot of stress, especially if it's like unneeded.
Yeah, I feel like it would be much easier to panic
Yeah.
over something that
exactly.
maybe you don't need to panic over.
I would be not the post-op nurse, business owner, entrepreneur that I am today without my experiences in the ER. Because our training is, you immediately go to what's the absolute worst case scenario, and we work backwards from there. So, number one, are you dying? Okay, you're not. We can go down from there. So you kind of de-escalate down the list of, okay, we're checking all these things off. And I've seen, the absolute worst of the worst patients and conditions and post-op care that people come to the emergency room with. And I've also seen patients present to the emergency room with infections, with post-op complications. And I know what those really look like when you see severe sepsis or severe infection, or maybe someone had a hematoma under one of their incisions. I have seen that through and through 100,000 times. So that's what we are also able to train our nursing staff. They already are masters in ER or ICU, so they have that too. And it's something that we pass down to them to be able to look for. And, what isn't a big deal to us sometimes is a really big deal to the patient. So we have to meet them where they are and understand that, we are not worried about their care. If it were looking like this, I would be worried, but you are looking great is really important part of what we do when we sit with patients, because I always tell them, if I'm not freaking out, you don't get to freak out, because you will know it when there is something wrong. And that has never happened. We've never had anything that way. And that also is kudos to the surgeons that we work with. We really make sure that we align our company with the best of the best surgeons in the Dallas area and make sure that we have relationships with them to where we're updating them also with the patient and checking in and able to give them peace of mind, to say, hey, your patient's doing great. Here's their vitals. Do you have anything you want to communicate to them? That's another part of is just relationships. And we have great relationships with so many surgeons in Dallas, and fostering that is a really big part of our success too. That way they're comfortable with us and we're comfortable with them, to know what their expectations are for their patients.
Yeah, collaborative communication is so important.
Mm-hmm. It
You
is.
touched on this a little bit earlier, but what happens when women try to bounce back too quickly or skip the proper recovery protocols?
Yeah. So what happens is these patients, their body has an increase in inflammation. So their incision sites aren't healing quickly and as clean as that they would like. A lot of times when moms are trying to bounce back too quickly, that's when swelling comes, because you're moving around and bending over, and swelling starts to pool in certain areas. And then, that was from them moving and exerting themselves. And a lot of times it can just, your incisions and suture sites just don't heal as well. And it's really all about the elasticity in your skin and being able to recover that, and drinking lots of water and staying away from salt. It's really minor things that are big. And I think that's where a lot of people get sort of, I don't want to say messed up, because they don't get messed up, but they get off track because they are so minor, of avoid salt, avoid sun, avoid getting in the water, don't be bending over and lifting things too quickly. Those are all very basic things, but you don't think about that being a problem until you're a few weeks down the road and you're not quite back all the way to how you would like to be yet.
Yeah. And I think women a lot of times underestimate the time that they actually need to rest.
Yeah.
Yes. Yeah.
And not do anything,
Yeah.
Exactly. And so we try to tell all of our patients, give yourself at least a couple of weeks to get back to homeostasis. Obviously still follow all the guidelines 2 weeks and beyond. But, don't be planning any events that week of your surgery. Make sure you have someone to cover kids and lifestyles and move appointments around, so that you really can just kind of shut your mind off and heal and get back to your normal quicker. A lot of patients are coming into plastic surgery because they're wanting to change something about themselves. And whether that's from insecurities or just something that their body isn't how it used to be before they had children. And so coming out of plastic surgery, you also have to be very mentally strong to know that you're going to look better and fix something about yourself that maybe you didn't like, and that it is going to get better. So keeping a positive mindset is super, super important also.
I love that. Well, you had talked about the healing equation. So can you elaborate and break down what that is for us?
Yes. So there's really just a couple of things with our healing equation that really we try to implement with every patient, no matter what surgery they're getting. And first and foremost, it's rest. Second, it's no sodium. And third, we really recommend lymphatic drainage massages. And with the three of those, really, it doesn't matter what surgery you have. That is the way to get back to yourself as quickly as possible and have the best results. Of course, we always have it cleared by your surgeon when you can start having lymphatic drainage massages, but that's very popular. And we have someone who is a specialist in post-op lymphatic drainage. So she is the expert in, following our patients for 4 and 5 and 6 weeks afterwards, and really making sure they're draining the toxins out of their body, because with hydration and lymphatic drainage, you're getting all of the anesthesia out. You're getting the pain medication out. If you had antibiotics that are lingering around, you're getting things out of your body that shouldn't be there. And a lot of patients don't understand the why behind, why do I need to stay so hydrated? Why do I need to get these lymphatic massages? And all of that goes around to your circulatory system. And the more water and hydration you can have, the more viscous your lymphatic system is to be able to quickly drain out all of the toxins that you had to undergo this major surgery. Because anytime you have an incision or something happen to your body that's not quote normal, your body is trying to fight that and attack it. So when you get a mommy makeover, you might have a couple different incisions and your body doesn't know that you wanted to get this surgery. So your body's thinking, oh no, I need to go into attack mode. I need to heal this area. I need to send all of my blood cells there to oxygenate this. But really, staying hydrated and getting lymphatic drainage to get that off as soon as possible, it really helps. There is a benefit to lymphatic drainage massages as well that does tend to make your results look a little bit cleaner. But we think that the most important part is how you feel afterwards and to be able to rid yourself of toxins. So I know you guys talk a lot about holistic medicine, and it's so, so important because the way that we feed and nourish our bodies is crucial to healing. Patients that do really well after surgery are patients that they're very healthy. They make great lifestyle choices going into surgery. So they've got, a high protein intake regularly. They're very hydrated. They tend to come out of surgery looking more hydrated, and they actually have better outcomes. But being able to be someone who takes care of yourself before is how you're going to come out on the other side. And food is medicine. So what are you eating leading up to your surgery? Are you having a lot of salt? Are you eating a lot of carbs or sugar or things that don't put your body in a calm state? Is something that we also like to talk to patients about, how they're preparing their bodies for surgery.
I mean, obviously, I think that nutrition is pivotal for healing,
It
and I've
is.
seen that
Yes.
firsthand.
Patients that are getting surgery, especially if it's an elective surgery, and this goes for plastic surgery, orthopedics, all different types. Surgeons actually won't take cases if their patient is too unhealthy and not fit for surgery. So
Yeah.
that's part of it too. When you have a pre-op appointment with the surgeon, they look at you as a whole. You get an EKG clearance, you go to a pre-op appointment with your primary care doctor. They make sure your heart is in good enough shape for surgery. They make sure that your blood levels are okay. And you basically have a physical before you go in. So that's something too that if patients don't understand, if you have a heart arrhythmia or, your diabetes that's uncontrolled, you're not going to be a good candidate for surgery. And surgeons probably, depending on the case, might not take you because they need you to be healthy too, since you're going into an elective surgery and anesthesia.
That makes sense. Are there other tools and therapies you haven't yet mentioned that you also provide at Post Op Collective? Like besides lymphatic and post op support that you're providing patients?
Yeah. So one thing I didn't touch on was our transportation. So this is for patients who they just, they're having a relatively minor surgery, but they will be going under anesthesia. And I do realize that I just said minor surgery and anesthesia in the same breath, but it does happen. And we have a driver that can pick patients up, take them to surgery. And then after surgery, they'll have a nurse that rides with them home, make sure they get inside safely. And then whoever's taking care of them can take it from there. Another thing that we like to offer to our patients and refer them to is hyperbaric oxygen therapy. And you guys had Liz Swale on, and she
Yes.
is the owner of Alive and Well. So we refer a lot of our patients there. And what hyperbaric oxygen therapy does is it just forces oxygen back into the cells. So that promotes healing faster, it increases your circulation, and it helps with your scar and tissue healing. So a lot of patients like that. It is relaxing. You can go lay in the hyperbaric chambers. Some people do get a little claustrophobic, but they have a beautiful studio at Alive and Well, and our patients really like going there to feel like they can get back to themselves.
I love that. It's so interesting to hear that that is what you're providing because I think that that's like the ideal situation I would want. But I don't think I've ever heard a patient go through elective surgery and say that they've
Right.
had those resources. It's
Right.
usually like stripped down, bare minimum.
Those are such great tools. And
Yeah.
maybe there are a lot of people that don't know that combination can really aid in their recovery and
Yeah,
long
make a
term.
huge difference.
Yeah, and this all gets discussed in our pre-op appointment with the patient, where we can ask them, would you be interested in hyperbarics or lymphatic drainage massages? Would you consider getting an IV? We don't administer IVs, but we, of course, Alive and Well does there. But that's where, we're doing a lot of patient education so that they know really what is out there to help them heal faster. If there's any supplements that we recommend that's approved by their physician as well. Sometimes we can recommend arnica supplement. It really helps with bruising and decreasing bruising after surgery. So we always like to tell patients about that, of course, with physician approval always. But That's sort of the world of plastic surgery is people just they see something in themselves that they want to change, and then the journey looks like them looking on Instagram or YouTube and following surgeons and looking at them, spending a lot of time figuring out who they want to perform their surgery, saving the money to do it, and then finally getting the surgery, and then, and then what is kind of what they say
Not
because they
having
put
a
all the
plan.
mental effort
Yeah.
into that. So we navigate, we sometimes call it the fourth trimester is where what we like to compare ourselves to sometimes because when you're having a baby, everyone's like, oh, first trimester, second trimester, third trimester, and then the recovery of the fourth trimester can be really tough. So we really take care of the fourth trimester of surgery and really help patients navigate what that's going to look like. And sometimes that also looks like helping them pick a surgeon. We get patients from out of town all the time who they're not local in Dallas, so they don't know if I should go to this surgeon for this or what is your experience with this surgeon? So a lot of that is kind of helping guide them based on their needs and what surgery that they're liking to have. And we of course let them choose whichever surgeon they want. A lot of surgeons that we work with and some surgeons that are new to us, occasionally that patients pick, and we really like to be part of that journey for them to see them know all of their options because making an informed decision is the most important part about surgery. Anytime you're trusting your life in someone's hands, then you need to be very well informed of their credentials, their office staff, the surgery center, looking at past results and all of those type of things. We ask those questions to our patients to make sure that they've looked into that and are really comfortable with their surgeon.
It's really incredible that you not only provide the services, but you do act as a consultant as well to help guide patients through the whole process of their surgery.
That's one of my favorite parts, truly, about working with the Post-Op Collective and our patients is getting to take the time to give them just an outside person's view. Sometimes they're saying, I saw this, I had 3 consults, and here were the 3 different things. And of course, we never coach them one way or another to a surgeon. We just help them ask questions to help them have clarity of what's important to them and what are their values and what are they looking to get out of their surgery. In this age of plastic surgery, it's starting to become a little bit more popular for people to talk about what they've had done. I think, especially in Dallas, there, of course, has kind of always been a large plastic surgery culture. Recently, with the popularity of GLP-1s, there's more people out there speaking about the GLP-1s that they're taking. And it kind of reduced the stigma a little bit of, oh, okay, we can talk about this in our mommy walking groups or in the pickup line. And so people are starting to become more comfortable talking about plastic surgery.
Can you share a favorite transformation story, someone who really benefited from your care?
Yes, I absolutely have one. We had a great patient who she was getting a deep plane face and neck lift. She also had a blepharoplasty, and she actually had photos from her past going back almost 20 years. And her mission with her surgeon was, here's the picture of me when I was 20. Here's me when I was 30. And she said, I want to look like this. And she actually came with her photos of saying, this is just something that I want to look like this again. And she went through the surgery and we helped her recover. And she did manual lymphatic drainage massages for about 5 or 6 weeks, just exactly how she needed to, twice a week. And it is one of the most rewarding patients that we've had. She looks absolutely beautiful. She did look beautiful before, but she just wanted to shout it from the rooftops that she felt so much better about herself. And she was talking to us about her husband, and she just felt like they were connecting so much more. And she had this done, and they were actually planning a trip for the end of the summer, and she was so excited to just take photos, and that was so rewarding. She was so sweet and just someone who, again, just wanted something a little bit different, nothing super major, which that was a very major surgery. But to her, it was just fixing a little bit here and there. And we still keep up with her today. She looks absolutely fabulous. And just to be able to see patients feel confidence again, a lot of people don't get in photos with their kids. They don't get in photos with their husbands because they're feeling insecure after they've had children. And sometimes it is a diet change that's needed or a lifestyle change. But sometimes there's things that just won't be fixed with diet and lifestyle and that won't go back to normal. So there are some things that plastic surgery really is needed for to fix. And to see patients go from post-surgery, bandaged, incisions, groggy, to 3 months later when they're sending us photos or posting all over their social media, you can just see that flip that switches. And it is the best feeling in the world.
That's super rewarding. And I just love that you said she wanted to look like a younger version of herself, essentially.
Yeah, not somebody else.
Yes, exactly. That's what I loved too, is she wasn't saying, I hate my face, I hate my body, this or that. It's just, oh, I really would love if I just had this a little bit tighter or a little bit, here and there. And that was really great. Yeah.
Do you feel like as people are being more like communicative about plastic surgery, more open about body changes, have you had like a lot of like word of mouth referrals, kind of like bestie to bestie? Like, hey, if you're going to have this thing done,
Yes.
we have a good team for you. I feel like that would be so powerful.
Yeah.
Yep. We either have patients who they are the private entrance patients, take me straight to my room. Nobody knows that I'm here, turn my location off on my phone. I don't want anybody to know except my surgeon and my husband that I'm having something done. But then on the flip side, we get so many referrals from the mommy groups, really, of them saying, my girlfriend, she just had this done. And she said that she absolutely needed someone to help after she had her surgery and really raved about the first 2 or 3 days after surgery. So that is a lot of our referrals come word of mouth from friends of friends of friends, which we're always so honored by. And, sometimes it sells itself because we're taking care of the patient and their friend comes over.
Yeah.
And then they're saying, oh, so this is what it's going to be like. And they can get a little preview into, we had some friends that they were both going to get the same thing. And one of them went first. So the other one came over and was kind of taking notes for better or for worse. Thankfully, she saw that she wanted to go through with the surgery, but, she booked us also and said, yeah, that's super helpful to have someone there with them. We work directly with patients that reach out to us. And then a large part of our business also is working with the surgeons in their office. So really being pre-op appointments, a lot of times our office managers that we work closely with will ask the patient, what are your plans post-operatively? And they'll kind of get that conversation going. And then they're able to refer them to us as an option for their post-op care. So we really take a lot of pride in the surgeons that we work with. And we've got a great, great network of surgeons and they're
Well, and you make them
local.
look better because you're helping them, their
Yes.
results.
That is a great point. Yes, and we
You're
do have
enhancing
surgeons
that.
who, they express frustration because there's only so much you can do as a surgeon, right? You spend
Yeah.
8 hours operating on a patient. This was your whole day. You did this insane surgery, which is art, really. Plastic surgery is art. And if you have a patient that doesn't follow your discharge instructions, they don't follow the rules that you have about stripping their drains, about, going and getting back into Pilates the week after surgery, and maybe don't travel to Cabo on post-op day 3, which has happened. So really for our surgeons, they love us because that is almost insurance for them afterwards,
Yeah.
that if
Yeah,
we're
you're
there.
enforcing.
Yes. And with each surgeon that we have, we take their custom discharge instructions because it's a little bit different for each surgeon with their preferences. So we just do not have a one size fits all when we care for patients. We really make sure that we check what is their surgeon's preferences and what are their discharge instructions so that we make sure everything is aligned with what their surgeon wants. We really do walk hand in hand with their office staff, their office managers, their secretaries, patient coordinators, the surgeon. We have their cell phone number so we can pick up the phone and call them, and they feel security knowing if my phone's not ringing, then everything must be good.
So if we have individuals who are like inspired by this conversation and are like, oh, I want to work with Eliza. I want to pick her brain on my next elective surgery. How do people get in touch with you? How do they book? What does that look like?
Yeah, they can go to our website, contact us, and book now is a tab on our website. They can fill out a questionnaire and that will come directly to us. We get back to you within usually the business day or 24 to 48 hours. Or they can text us directly. We have our phone number that I'll share with you, and you guys can post that also, where they can text or call us, and we'll set up a 15-minute consultation and really be able to talk them through what their needs are.
That's great.
Awesome.
Is there anything new on the horizon for the post-op collective?
Up and coming.
Yes, incoming. Yes, we are expanding and growing, which is so exciting. So we've got a few surgeons closer to the Fort Worth area. So that means our west side of the DFW Metroplex is picking up a lot of volume in the South Lake area. So we're really growing across the DFW region. And so 2025 is the year of growth for the Post-Op Collective. And it's super fun for us to be able to serve patients out in Fort Worth and everything in the middle. It is such a blessing to be able to take care of people in this time of their life. And we're just so excited. And the trust that patients put in us, the trust that surgeons put in us, it means everything. And that's really important to us.
You're doing really exciting, helpful work,
Yeah.
and you're clearly changing the narrative around recovery. What do you hope women understand? What's a takeaway from today and from your work?
And to feel like they're empowered, that they can fix something about themselves if they truly have tried everything, and that there are people here that will help them on that journey as well. I think there's sometimes can be guilt that people feel when they get plastic surgery and maybe even a little bit of shame that they had to get something done. But we really just want to empower women that it's okay to have
Mhm.
surgery and to want to fix something small about yourself and give them their confidence back. So we really just want women to not feel like they have to totally change into somebody else, but they can do something, whether it's small or large, to still stay true to who they are, but just with a little bit of confidence boost and that they can recover well and get back to themselves and not feel like they have to stay in a slump because they don't like something about themselves.
I think as like moms, I think I love that you guys have a message that like you shouldn't recover alone and that
Mhm.
you shouldn't recover yourself. Like, I
Yes.
know that I would hire somebody for my spouse or my son at the drop of a hat. So knowing that that is an option for myself also like really speaks volumes.
Right. We had a patient who we were taking care of her, and we found out while we were in her post op recovery. She said, my husband had shoulder surgery 3 weeks ago. She went into wife mode and she said, oh, I can do this. I can take care of him. He had a shoulder replacement. And she said, I know. I should have called you guys, but I didn't. I thought I could do it. She said, but it was just great confirmation for him that, okay, perfect. When I'm having surgery coming up, we are definitely having someone come in and help you because there is a lot to it. And it was just funny. She was teasing her husband. And of course, he's like, yeah, she wasn't the best nurse.
It's a
But
big
yeah,
job.
It's a lot.
it is a
Caretaking.
Yeah,
big
it's a
job.
lot.
Yes, it's a lot of pressure. A lot of women don't want their husbands to see that the immediate post-op result. They want them to see
Yeah.
them when they're back and glowing.
Yeah.
But it's always fun to see, the dynamics that people have. Some people don't even care at all.
Yeah.
I love that you've had the ability to change like this classic nursing role into something that's like really valuable and so unique and so niche, but really needed. So I'm excited to see how you guys grow. And I'm really thankful that you gave us more details on it today because I
Yes.
really think that this was a lot more expansive and you guys have a lot more resources than I realized.
Yes. And I was just going to say, we love meeting you and hearing just the why behind your business and, how it's growing. It's really exciting.
Yeah, thank you. It is. We're just trying to modernize healthcare and be as efficient as we can be, which is not the norm for the healthcare industry. So we're
Yeah.
always innovating. We're always trying to change our practices and our technology to be faster and better for our patients. So it's been super fun, very rewarding. And yeah, I can't recommend having a nurse help you enough after surgery. That's my big, the whole reason we started this company was to help people.